patients so that when you're going to other action items and other issue areas that you're interested in, you don't have to fill out the form. You can just put.
I am super excited to have everyone here. Thank you so much for tuning in. Like I said, this is our second Chronic University of the year. We're talking all about advocating for patients 101. And we are going to get right into introductions. My name is Tatiana, or Tati. Everyone calls me Tati, so feel free to call me Tati as well. I am the director of patient engagement here at the Chronic Disease Coalition. I am also a chronic disease patient myself, so I have ulcerative colitis and psoriasis, which is an interesting tie-in for Julia. And today, like I said, we're going to be talking all about advocating for patients 101. So the goal of today is to really help you, whether you're managing a chronic disease or you know someone who's managing a chronic disease, to really better understand how you can make an impact with advocating, especially at the state and national legislative level. So really, really excited. We're going to have some really great conversation. I do want to introduce everyone here on the panel. So I will pass it over to Curtis to start.
Good morning, good afternoon to everyone. My name is Curtis Warfield. I am a CDC ambassador and also patient advocate, a 5-year kidney transplant recipient from a living donor, and I'm from Indianapolis, Indiana.
Thank you, Curtis. So happy to have you here. Julia, do you want to go next?
Sure. Yeah. Hello, everyone. Good day, good morning, etc. Since that is our theme, I guess. My name is Julia Boles. I'm the Grassroots and Advocacy Manager at the National Psoriasis Foundation. Definitely thank you to the Chronic Disease Coalition for having me for this super important discussion about how patients and their caregivers and anyone impacted by chronic disease can be part of the legislative process and shape healthcare policies that then impact all of us. So excited to dive into that discussion and chat more about that, but I will yield for now.
Thank you, Julia. So happy to have you here. Representative Riccelli, would you like to introduce yourself?
Yes. Hi, everybody. I'm State Representative Marcus Riccelli. I'm a legislator in Washington State from the Spokane area. I apologize. I'm coming to you from my cell phone. Like any good technology issue, I haven't had a problem, and then our provider went down. So I will be coming to you through this kind of goofy cell phone vision. So I serve on the healthcare committee. I serve on our rules committee, our transportation committee, and our capital budget committee. I'm a member of our leadership team. I serve as the House Majority Whip. Also importantly, I think for this conversation, I also served as a policy advisor for a state Senate majority leader at the time, and I worked for U.S. Senator Maria Cantwell. So I've kind of seen it on all ends from advocacy. I'm looking forward to engaging in conversation, talking about a few tips and tricks and how to be effective advocates. And I just really appreciate the opportunity to join you all today.
Thank you so much. We're so happy to have you here. Mary Kay, would you like to?
My name is Mary Kay Clemens-Ross, and I'm with the CDC, and I'm the interim director of policy. So really glad to be doing this with everybody.
Yes, amazing. Mary Kay has some great insights and stories as well. So excited to have you here. And Brian Dorn, please introduce yourself.
My name is Brian Dorn. I'm the manager of digital media here at the Chronic Disease Coalition. I'll be in the background here providing space to our wonderful panelists, but I'll just be kind of the digital maestro here. So hit me in the chat if you have any questions on the digital side. Drop your questions in the Q&A. I'll be monitoring that as well. And then I'll do a little walkthrough on how to send a letter for Chronic Disease Month at the end here. So happy to be here and eager to have this wonderful conversation.
Yes, thank you, Brian. And like Brian mentioned, please, throughout the panel, if you have questions, please pop your questions in the chat. I will be doing my best with Brian to be monitoring that as we are having this conversation. We will have Q&A at the end, but I will also be flagging any prevalent questions during the conversation. So please make sure you utilize that as we are going through the conversation. So I think this is a great time to really jump into the meat of the panel and really talk about what we're here to talk about today, advocating for patients. So I would love to start off with Curtis. I'd love to start with you and just really get to know your story a little bit more. What in the process as you became a patient advocate, what surprised you the most? What was scary? What was fun? Like, just give us a little bit of an overview of your story and how you got involved in the process of being a patient advocate.
Okay. My journey started back in 2012 when going through regular checkups. My labs came back. There was some irregularities going on with my kidney function. I was sent to a nephrologist who did some additional tests and came back with being diagnosed with stage 3 kidney disease. It was very aggressive at the time, and by 2014, I had lost basically all kidney function and started peritoneal dialysis. Fortunately, by February of 2015, I was able to make the transplant list. And then it was around that time my daughter herself had heard about being a living donor and decided to get tested after we had had a big fight, and she won the fight. So she went to get tested, and unfortunately, the results came back to whereas we were not going to be compatible. But she heard she was just graduated from school and was living with one of her sorority sisters who had heard and knew what was going on with her test and decided that she wanted to step forward and get tested, and turned out to be a perfect match. Well, on January 8th of 2016, the surgery took place. Everything turned out wonderful. The kidney started working immediately. My donor's been doing well ever since and is thriving in life. I'm doing quite well. And it was through that time of being diagnosed all the way through transplant, some things that I went through as far as physically, mentally, that it was at that after receiving that kidney, I wanted to be more of an advocate and more of a voice, because there were things finding out about preemptive care that could have went on, about additional tests that could have happened before my kidneys failed that could have helped with some additional treatments to at least slow down that disease. And hearing other people's stories of going through some of the same things, of feeling alone and not being supported by anyone, maybe their families and stuff. So for me, it's a way of giving forward. And in doing so, I found that it's not as difficult as what a lot of people may think. There's not that big barrier wall that will separate you, especially when you are talking with your legislative bodies, both at the state level and the national level. They're human, and they do actually answer calls and stuff. So it's been an exciting time to step forward and talk with our legislators about different bills, immunosuppressant bills that help with the cost of organ transplantation, Living Donor Protection Acts that will support people like my donor for insurance protection. So I would encourage people, and we'll get a little more into this hopefully, to go ahead and call your representative, meet with some organizations that may support your call. And it's a very exciting time. It's a good time to network with people. You build relationships, both on the advocacy side as well as the legislative side. So that's kind of what I'm doing, and continue to do that.
That's awesome. Thank you so much, Curtis. And you kind of touched on this a little bit, but when you first sort of got started, speaking with legislators and getting more involved in, policy advocating, what surprised you the most when once you started getting your foot in the door and started really going through that process?
Well, what surprised me the most, like I said, it's not as hard as what you might think. Sometimes we think that it's hard to get in touch with uh, our legislators, that you
Mm-hmm.
have to go through all this red tape and you may not get a reply back or anything, whereas it's easier than you think. And it's like what people will say. They are there in office to help and support your causes. So it's easy to send an email and you'll get a reply. It's easy to call the office and try and set up an appointment. Uh, don't be discouraged in case you don't hear anything in the first 5 minutes after you've sent out a call or sent an email.
Mm-hmm.
Again, they're a working office too.
Mm-hmm.
So kind of be persistent with that. And as I said, it helps to have an organization or two behind you uh, when you are going to make those calls and make those contacts.
Mm-hmm.
And if not, set up your own group and go as a group. It's a lot easier that way.
That's awesome. I love that. Thank you so much, Curtis. And we have a really great question in the chat that I would love to open up. I think that Representative Riccelli might have a good point of view on this one. But Rose asked, when is the best time of year in the legislative calendar to approach a legislator about potentially sponsoring a new healthcare related bill, specifically a patient bill of rights type of bill? And then she mentioned Washington State even more specifically.
Well, that
So,
seems like it's right up my alley for sure.
yes.
First, great question. A lot happens during legislative sessions at state capitol, and certainly there was a little bit of a difference during COVID times. But I do think that there's kind of a bit of a urban myth out there that it only happens there. For me, one of the most important times is what we call the interim period, when we're not actually in session. In Washington State, we're a citizen legislature. A lot of us have other jobs, but it's also a great time where we, back in Olympia, in our capital, we're going to committee meetings, going to votes on the floor. We're meeting with people, but a lot of times those are 15-minute time blocks, et cetera. When we're back in district, to have that opportunity to sit down with people and have longer meetings and really engage in meaningful conversations and talk about policy development is the opportune time. So that I actually prefer the time outside of session. In Washington State, there's a couple kinds of things that seem to be just the normal schedule. I'm more than willing to meet with people in August and September, but it seems like until kind of school starts back up again, people come around knocking. I do think the fall is a great time to really early, September for bigger legislation, certainly starting right after session ends. So we have a 105-day session in budget years and the 60-day session in non-budget years. So even in April, May, et cetera. But I really think the fall is an excellent time to be meeting with people, to be doing the work. And that gives us an opportunity to meet with people and also work with staff. We have both partisan staff and nonpartisan staff. Our nonpartisan staff are really subject and policy experts that we get to work with. That allows actually constituents to connect with the staff and ask questions directly, and we are conduit to that. So kind of a long answer, but to say that basically what we call the interim for me is the best time. Now, amendments, things like that can come up in the heat of the moment, and we try and deal with those. I will say too, it is important for folks, and it depends on what state you're in or whatever, but there's big differences between the staffing levels at the federal level and state level. Sometimes people think, oh, you must have like 30 staffers. I actually have one legislative assistant. I work with what we call caucus staff and our nonpartisan staff on the committees, but we actually at the state house only have one designated staffer. So I think that idea of working well and the importance of staff, but also understand you might not hear just like, it's not like a 24-hour time, but we do really feel, and when I first got elected, I would say I have 137,902 employers, and we really feel that way. And you should take that power. That's what we're there to do. We're there to represent you and engage.
That's awesome. Thank you so much. And Representative Riccelli, I would love to hear a little bit more about your background. I think it's, super interesting that you work in healthcare. Can you tell us a little bit more about your background and your story a little bit? That would be great.
Sure. So I also work for a federally qualified community health clinic part-time, where I was a project manager. Community health clinics provide a lot of care to some of our most vulnerable. In Washington State, we work with a lot of the Medicaid population to provide important primary care services, behavioral health, and dental. But my background really was, I kind of fell into politics. I wasn't one of those poli-sci majors. My roommates at Gonzaga, just to be frank with you, were like, why are you watching C-SPAN and drinking beer for fun? And so I just I fell into it. I was working at Merrill Lynch. I got first involved in electoral politics and worked on a campaign. I worked back in Washington, D.C. doing some advocacy, and then went to graduate school for public administration. And it was there when I represented graduate students at Olympia and cut my teeth in kind of what was going on at Olympia. Then worked for U.S. Senator Maria Cantwell, covering her Eastern Washington office. And I think that is kind of an important piece of what we're talking about today, because obviously Senator Cantwell wasn't able to meet with everybody, particularly in Spokane. So really, as a staffer, was a conduit to that. And that's one message I'd like to leave to you. Don't pass up a meeting. If you're at the federal level or on the state level, know that these staffers are critical. How you interact with them is important. And that message, you should, really treat those meetings as if you were meeting with the member themselves. So that's one key component I think today I'd like to leave you with. Then I worked for the Senate Majority Leader, Lisa Brown, in our state, and a seat opened up, and I just decided, why not, and went for it, and ended up in the legislature, and just an amazing opportunity to represent people. So that's kind of how I got to this job. But you really see the power of organizing around issues particularly, and what the grassroots organizing can mean. And you don't get elected to office and have some sort of cap of knowledge. So we need people with lived experience, with real knowledge in the area to bring that. Mm-hmm. I didn't enter the legislature with a huge healthcare background. I knew it was important for my community, so I went straight to that committee. But for me, it was a learning curve, and thankfully, because of people in community, because of stakeholders, policy experts, I've been able over the last 9 years to really just get more engaged on issues that I think are of most critical importance to our communities.
Yeah, that's great. And, sort of as a follow-up, Rose asked, what are some of the issues that you're most passionate about legislatively? I know you mentioned, things that are really important to the community, but can you talk about that a little bit more?
Oh, sure. So I've worked to lead a bunch of initiatives around oral health. I do think we've kind of forgotten it. It's kind of that next step. We've been able to incorporate behavioral health, and I think oral health is kind of where behavioral health was maybe 3 or 4 years ago. And just I believe all health starts with oral health. I've been really engaged on telehealth, particularly providing expanded access for behavioral health and primary care. That's been a real passion of mine. And just overall primary care access. I was the prime sponsor of the bill to create a second medical school in our state here in Spokane, the Washington State University, Elson Floyd School of Medicine. So just creating greater access and workforce issues around healthcare and that's not just doctors, that's NPs, PAs, phlebotomists, etc. And usually I just try and work in phlebotomists so I can impress my mom and tell her I can say the word correctly. Those are the people who draw blood. But
yes, so it's a fun word.
A lot of that. Yeah, and then my other big passion is around food security. I don't think people can thrive if they don't have access to the basics: housing, healthcare, and food. worked with a group that we in Washington that we call the Food Fighters to really bring more attention to food insecurity in our communities. And just think that, like, you know, that is something we should take off the table. So I've worked really hard to provide greater access to food in our schools. I think schools are a real place as well. I was part of creating our first school-based health center in Spokane and making sure we're bringing that access closer to those who need it most. So that's a little bit. I know we're here to talk about a number of other things, but those are some of my passions.
That's great. Thank you. Thank you so much. I love to hear that. I do want to just ask another question, and I'm curious to hear from all of you. I think, Julia, you might have a good perspective on this. So Deb asked, how do you get anyone to listen and hear what you are saying? They mentioned that they have a rare disorder. So I'd love to hear your perspective on that.
Yeah, no, thank you for the question. I had noted Deb's question and thought it perfectly teed up what I was planning on talking about anyway. So that is, and it's a great question. I think the first thing that comes to mind when I hear that question is just kind of giving you, as the advocates who live with the disease, the reminder that you are the experts first and foremost. I think, as Curtis said, you know, legislators are people. They also, you know, might have chronic diseases and shared experiences. So just remembering, you know, as you think about how you want to influence the process and share your story, that you are the only one who knows what you've gone through. So I think that's just like a really important point to start on. But in terms of how you actually get involved in that process, I think just starting at knowing you're the expert and then wanting to get involved is a great first step. Part of what I was asked to talk about and planning to talk about that I think mixes in here well is just that organizations like mine, like the National Psoriasis Foundation, the Chronic Disease Coalition, and others have a ton of tools to help you take those first steps. So it's really just a matter of connecting with the right people, the right organizations, whether it's specific to your disease or the Chronic Disease Coalition, and just learning how you can share your story, or like who to email, like just what do you do? And I know later we're talking about how you send a note and take those first steps, but really we are here, and people in my position in grassroots advocacy are here to walk you through that process and help fill in those knowledge gaps that you might not have. So as long as you know you're, you know, comfortable talking about your experience, you might have a certain access barrier that you've encountered, whether it's high out-of-pocket costs or issues like step therapy that I know are shared between my organization and the CDC. You know, if you know what those experiences are, or you know what your policy passions are, just coming to organizations like ours and saying, what do I do next? Because chances are there's already a coalition of other organizations that are you know, gathered specifically around advancing that legislation, and then they can really advise you on how to get plugged in. And the other thing I'll mention, and then, you know, I'm sure we'll come back to this, but I think also just building relationships with your state and federal representatives, so that even if you don't have a bill that you need them to sponsor or co-sponsor today, just making sure they know who you are, so that when important issues pop up, you can give them a call, or maybe they'll think of you as like, oh, you know, I saw this bill come across my desk about rare diseases. Let me give Deb a call and ask her what she thinks as someone who's living with a rare disease. So I think also just thinking about the timing and realizing that, you know, if you know you want to be working with someone on something, sometimes it takes a very long relationship. So I definitely have stories, and I'm sure others do on that topic, but I'll pause there and let others talk first.
Well, I just wanted to add, I think you had a really great point about kind of that long-term connection and building relationships. And one of the things is we expect people when they come to us to talk about the issue that is directly impacting them. What I think a great tool is too, is when you're building a relationship with a legislator, really take the time to understand the issues that they're working on. And there might be something that you can lend your voice to that wouldn't be first like that primary issue. I think that is a great way to build a relationship as well, that might have a secondary impact on you or your family or your neighborhood, et cetera. And that's a great way to meet with folks. And really it depends, but you know, if you put an email and say, I have, you know, the power of a group, I have 5 or 6 people who want to meet with you from your district. I mean, you're really putting on that legislator who, quite frankly, I think most elected officials are really, you know, working hard to do what's best for their community, but they have elections coming up too, and they it's their job to be responsive. So if you put it out there, like I have 5 or 6, not an ultimatum, but that would really like to go grab coffee with you or etc. It's a great way to get their attention too.
Yeah, Curtis, do you have anything to add on this front?
Just quickly, I just want to piggyback both on what Julia and Representative Riccelli said. Working with the staffers are very important. I think I have better relationships with the staffers than I do actually with the congressman and congress lady. They actually can get in and make a more important pitch for you, and they have to kind of listen to their staffers, if I'm kind of correct. So that really helps a lot. Also, your story is very much important. That is the top thing that will actually grab the attention. And I actually had my congressman one time tell me, skip the stats. What are you here for? What is your story? And tell me about it. So it's really important for the legislators to hear your story and find out what's going on. And if they may not be part of, say, a health committee, they may be able to refer you to someone else. And referrals from other legislators help just as much as talking directly with that legislator. So it doesn't matter how rare the disease is or how more popular it may be. And really with rare diseases, that may come across even more important because it hasn't been heard. So I would just say keep pitching forward.
Yeah, I think, Julia, did you have something to add? I saw you.
Yeah, I was just gonna, I would love to piggyback on your skip the stats comment, Curtis, because that was one thing I was gonna say as you know, a staff member of a patient advocacy group. You know, I can talk all day about statistics about the percentage of people with psoriatic disease who, you know, experience therapy or other access challenges and, you know, give a hypothetical story or even like a real patient story. But really, when I'm able to facilitate and you know, it's you guys wanting to be part of it to get a patient in the room in front of the lawmaker to say, all of those stats you heard, I am one of them. And let me like walk through sort of all of the real life implications that this has. You know, you are in the best position to not only talk about sort of the healthcare element, but also talk about what impact that has on your ability to be part of your local community that your lawmaker represents, you know, how it affects the activities you do, the work you do, you know, being able to say, I have to drive from this town to that town and things like that. It really helps them visualize what's actually happening and be able to better put themselves in your shoes in a way that staff at you know, organizations like mine, like we can't quite get that last little piece of the real human story. So I think that that's definitely part of why it's so important is your story tells the realities behind the statistics.
Yeah, I would just say for me, Amanda and Emma. So let me tell you about that. I had a meeting in January with Amanda, a mom, and Emma, a young child that was dealing with seizures, and they were working on seizure safe schools and House Bill 1085. I met with them in January. They filed up with emails. We communicated throughout session. They were informed working with the tools that organizations provide. They knew what we call cutoff, when bills were approaching deadlines, that if they didn't continue on, and they advocated at every step of the way. But it wasn't because, I mean, it was certainly good policy and legislation. But every time I thought about a vote out of committee or off the floor, it was Emma and her mom talking about what Emma dealt with in school, and Emma speaking for herself as a young person in our schools, and it allowed me to communicate with my colleagues too, who were maybe not as informed about it. So the stories matter, and those meetings really do make a difference.
Yeah. I was just going to ask you, Representative Riccelli, if you had any real life examples. So thank you for sharing that. And I think that is such a huge, I mean, at least from my perspective, something that I have really learned being a part of this organization and as a chronic disease patient myself that I didn't know before was that, as the patient, you don't have to have all of the stats and the research. It's really just about your story and how these things really do affect you in your life. And it's really that easy as just sharing your story and using your voice. And I think that that has been a huge takeaway for me, and I hope can be a huge takeaway for other people watching today. And then just sharing your story can make such a huge impact on the laws that, are coming out. And I think it's really, really cool that we can use our voice to impact. So I would love to just also do a plug. If anyone has any other questions, please feel free to drop them in the chat. I would love to open it up to everyone and really just talk about, what do you think the first steps are for patients or patient advocates to get involved in wanting to take their advocating to the next level? What are those first steps for people?
I'll go first.
Yeah, go for it, Curtis.
For me, it was finding an organization out there that was related to my disease, which I looked at the National Kidney Foundation and started with them and found that they had a advocate agenda as well as an advocate group, is what I'm trying to say, and got involved by just sending email and responding to that cause there. And they were able to get it back in contact with me, and we've been kind of on board ever since. And I also did that with our state OPO as far as organ donation and all of that. And they too also had a advocate area that I could get involved with. I would start with looking at organizations that related to what you're looking into and wanting to fight for.
That's awesome. Julia?
Yeah, I can piggyback on that. I'm actually going to flip how I answer this a bit. I think as the grassroots staff, I want to tell you guys just a bit about the many different ways that advocates come to me, because I think that'll help you see what might spur that. So, I mean, I think one of the biggest things that I see is a patient experiencing some type of access issue. They can't get access to their treatment, or it's too expensive, or whatever it is. And that obviously spurs an interest in trying to do something about it. And then they usually find the National Psoriasis Foundation. We have a patient navigation center that helps folks, navigate many issues or resources, including trying to get access to treatments. And so I think that's one big way. So all to say, if you're experiencing an access issue, or if you know someone who is, that's a great time. Once you finish resolving it and hopefully get your treatment and get to a point of being stable, taking that story. And I hear a lot of advocates say, they want to take what was a bad experience for them and turn it into something productive so it doesn't happen for someone else. So all to say, a lot of people who do advocacy that I work with had no interest in politics, or they didn't think I want to be an advocate. They just had a challenging experience and wanted to make sure that didn't happen to other people. So I think that's all to say that, you don't have to be politically savvy or necessarily think that I'm an advocate, because you grow into doing that. We also work with folks who are newly diagnosed. I think, like Curtis mentioned, sort of people wanting to find a community, and advocacy being a good outlet for doing that. Even if you haven't experienced the issues you're advocating for, it's you're still advocating for yourself to try and prevent that from happening in the future. And then I think the third area that we sort of interact with people is if we're working on a bill that's local to them, kind of finding them that way. But back to sort of the original question of what is the first step, I think definitely 100% agree with Curtis of just finding, that community that you want to start advocacy in, because all of the kind of hard work and scary sounding stuff really goes away once you meet people and feel comfortable in that environment to ask the questions that you have and learn how to share your story. So.
Yeah, that's great. Representative Riccelli, do you have anything to add on, tips and tricks for first steps for people?
Yeah, I mean, I think that that's a great connection because it can help make sure that your energy and efforts, which might be limited as far as time, that's kind of the one constraint lots of people face, are most effective. For instance, an organization that's already doing some of the advocacy can help find you to things that I think matter. Like, it's okay if people don't know, but we need basic civics as far as like who is actually your state representative and senator. Like in Washington state, everybody's represented by 2 House members and 1 senator in 1 district. That's different in different places. Who are your 2 U.S. senators and your federal representative? A lot of times people need some education on the difference between what can go on at state and federal policy. And I think these organizations and advocacy organizations are really a great place to start, so that you're not misdirecting your time and you're really communicating with the people, and they can help craft the message so that, I get a lot of calls about federal legislation because people are confused. Well, aren't you my federal representative? No, I work, at the state level, and can help sort that out so that when you have those opportunities to share, you can be most effective about what you're communicating on. And then it's just, I give my cell phone out at town halls, my personal cell phone, because I want to be accessible. I am always surprised that it's a handful of times that I actually get phone calls. Don't be intimidated by it's like what Curtis was saying, like I go and shop at the same place everybody else shops to get, I cut my grass, we're just people. And please, those barriers should not be that high. I mean, it's a little more difficult at the federal level, but they have more staff. And then that gets back to really connecting with the local staff for some of these federal elected officials. But as far as at the state level, I really challenge you to just be fierce in your advocacy, know that you are actually our boss and your input matters. So when you see those opportunities, and people like to be communicated in different ways, I think that's important. I'd love to say that, like, this is the right way to communicate with a legislator. Some prefer email better. Some prefer phoning their staff. Some, in this new world will respond to social media, etc. A great way to find out the best way to communicate is usually through staff. So an official call or email to the office first. But there's different tips and tricks, and that's part of that building the relationship that matters.
Right. Yeah. It really is about building relationships. And I think viewing legislators like people, because they are, right? And they're all different. They all have different ways they like to be communicated with. And so really just looking at it like you're building a relationship with another human being, and really just having a conversation and talking with them, I feel like is kind of a great takeaway. I'm at least taking away. Would you agree? Yeah,
absolutely. I think, we're all, especially in Washington, citizen legislators, we're potentially working other jobs, raising families. We're just people. And that's what, the principles of our democracy. There's this gap between the people who represent and the people that'll just cause division and won't get anything done. Again, another piece too is like we want those trusted folks we can go to, and that's so building relationships is also building trust. So I know I can go to a Curtis in my district to get what is really on this issue, and I know that is lived experience. I also know that he's working with the organization and he's up to date, and that can really inform us how we make decisions at key moments. Our legislature in Washington, I think many legislators, is set up to not pass legislation. It's set up for a very high bar. So even a lot of good policy bills don't go forward because of there's just the time factor. And so really the squeaky wheel is what gets things done to draw attention to issues.
Yeah. That makes a lot of sense. I kind of want to ask a question about what people can do if they feel like representatives maybe aren't listening, or they're having a hard time getting through to representatives. What are some tips? Maybe, Julia, Curtis, if you guys have stories, and then of course, Representative Riccelli, if you have any tips from your perspective of like how to help get representatives to listen to you if you're not feeling heard.
Yeah, I can start if you don't mind, Curtis, but it's such a great question. I think there are so many reasons why that might be happening, right? So I think the first thing to just think through is sort of what discussions have you had so far? Is the issue that, the office is busy? Like we talked about, they don't have like 30 staffers. So those are some of the first initial questions. Like, are you not getting through because they're not seeing your email? Or did you just feel like you had a meeting where like you didn't get on the same wavelength and you don't feel heard in that sense? So I think those are a little bit two different questions. I'm going to focus on the like, what if you had a meeting that didn't feel like it went well? Because I think the other issues, keep trying and call the office or something on that front. But I think approaching your meetings with legislators and thinking about it as an opportunity to educate, not walking in, especially if you're meeting with an office that you have a guess, might not agree with you on whatever issue you're talking about. Just think of it as an opportunity to put a human face to the issue and do a bit of education. And I think that really helps, you not feel as stressed out or necessarily like combative. Maybe if you're like already frustrated that they're not going to agree with you. So that's a long-winded way of saying sort of like patience and having the right tone in those meetings of just, I'm here to provide you with more information about my perspective on this issue. As your constituent, as someone living with a chronic disease, this is sort of my lived experience, which I think we've talked a lot about today, and just really approaching it that way. And then I want to take a quick second and just talk about a story having to do with persistence, because I think it's related here. We have an advocate who has had a really terrible experience with step therapy. It ultimately resulted in her having to have surgeries because of delay in not getting treatment for her psoriatic arthritis medication. And she had come to our Capitol Hill days multiple times. When she happened to be in DC for vacation, we set up meetings. She went to town halls, everything she could do to get in front of her federal senator to talk about why they should co-sponsor the Safe Step Act, which is the bill that would help address that issue. And it took probably 2 to 2.5 years of her meeting with him every few months. And I know that sounds really frustrating, but like Congress moves slowly sometimes, and that's okay. But like literally after a couple years of going to in-district meetings, going to DC meetings, showing up at town halls and asking questions, just a few weeks ago, he ended up signing on as a co-sponsor of the bill. And I think I definitely had tons of discussions with her through that process of why it was so frustrating that like, she either had a good discussion with the staffer, but then they didn't sign on and she didn't get why, or she had a discussion with maybe a different staffer who just didn't really seem like healthcare was a priority at the moment. So I think a combination of seeing every discussion or meeting you have as an opportunity to educate, and then being patient and doing that follow-up and reminding them that you exist and why it's important to you. But I'll pause there, and maybe Curtis has thoughts on that from the patient side, or Representative Riccelli from the other side, because I really just sit sort of between you guys.
Thank you, Julia.
No, I agree with what Julia said. And I know here at the state level in Indiana, although you're represented by your representative or your senator, you can actually go to other legislators and have them support or try and sponsor your bill. So it's a little easier at the state level. Now, at the national level, I was in other meetings with when we were sharing advocates, basically in multiple states, where we came across a legislator who just really seemed as though he did not want to listen or hear us, and that we were kind of being interruptive of his time. But what we wound up doing was, when we came back later, we had found other legislators who was supporting our cause and was able to relay that information that these other senators are actually supporting this bill that we would like to see passed. And they were able to jump on board then. So it's kind of the influence of who they may have their own relationships with, and saying, okay, if Senator A is in agreement with this bill, then let me look more into it and see that it's okay. So, sometimes it may be difficult talking with the person you would like to talk with. So see who else may be in support of that and go to them and come back with that.
Yeah, that's great. Representative Riccelli, do you have anything to add on this
Sure.
topic?
I'm pleased to be coming from my laptop now, not myself.
Yay!
Nice to hear. Look, I think a lot of what's been said is spot on. I think one, joining their like newsletter list, e-newsletter list, so you know when town halls are. We do teletown halls, we do virtual town halls, we do in-person town halls. A lot of members do. We do mobile like offices, constituent coffees. If you happen to be in DC and you're doing some advocacy, a number of the senators I know at Washington State and representatives have like designated times for just kind of a come all for the constituent, where usually the member shows up and definitely staff is there. Sometimes you just have trouble getting to office. That's why it's important to build those relationships too, because I think particularly locally, if you're talking at the federal level, if you build a relationship with that local staffer. So I was an Eastern Washington director for a US senator. If I knew that person was going back, I would work on their behalf to make sure they could get that in time and advocate for them. So just connecting it. I think the idea too, where you start first, you identify who your elected officials are at the state level, particularly, and you go to them first. But if you're not getting a response, you keep working that track, but then you go to the committee maybe of jurisdiction and look for some folks that might want to be. And through networking with other patient advocates or other community organizers, you can find out people in their district. And a lot of times, so a lot of my meetings, there'll be somebody from my district on an issue, but there'll be 3 or 4 other folks who are impacted from other parts of Washington State. And let's not forget, my first and foremost responsibility is the people I represent in my district. I also have a responsibility to the state of Washington as a whole. And I believe that's how a lot of elected officials take it. And then Curtis nailed it. Peer pressure to move some of the folks who are slower to come along. It always helps if somebody's willing to be the cut that, that trailblazer. If it impacts somebody in their district, they'll jump on. And part of it too, I will say, is not because maybe that elected official that is not caring about their issue. Everything that we do is competing for our time and where we put our efforts, use some of our political capital, etc. And then finally, and I'm not shy about saying this, at the end of the day, a lot of folks like to get reelected. So if you haven't heard from them, as elections near, say, hey, I'm a constituent, I'm a voter, and I'd really like to hear from you on this issue. And I think that is absolutely above board, not in a threatening manner, but to say, like, look, I need people who are there representing on behalf. And you'll be surprised at the ears that perk up sometimes that maybe have been falling asleep.
Yeah, I love that. That's such a great point. And everyone made such great points. I do kind of want to transition a little bit, and you kind of mentioned this a little bit, Representative Riccelli, but I want to dive into a little bit of how like telecommunications has changed online engagement and testimony. Of course, during COVID, so many things went virtual, and how many amazing opportunities that has brought for people. So I'd love to hear all of your thoughts on just how having things virtual has changed things and sort of what that looks like for the future. Representative Riccelli, if you'd like to start.
Yeah, I'm really excited to talk about this. I think this was one of the few silver linings about COVID. Washington State, we actually went to all remote. Our session, we went to session one day to allow us a rule change to allow us to do virtual session. So largely most are out there, and our committee work was done virtually, etc. What we opened up, in particular for me, for those who aren't familiar with Washington State, I'm not from the wet side of the state. I'm from the dry side. We have a big Cascade mountain range that divides us. And for a lot of the people I represent one of the most impoverished districts in the state. Giving up a day of work, transportation barriers because of health issues, etc., are huge barriers to participating in the process. We opened up to remote testimony, which was something we were kind of toying around with, and I have to give kudos to the Senate, which I usually make fun of because they take naps after 5 o'clock. legislative joke, but they were leading the way on remote testimony, and to our staff that really allowed that engagement. It has changed everything. We saw engagement go through the roof. If you can now not miss a day at work, and you can engage, if you now have an issue that just bars you from transportation to get to your state capitol, you now have that voice that you deserve during committees. And we saw engagement go through the roof. I think the other important thing is it really accustomed a lot of our offices in Washington State to engage towards virtual meetings. It can be hard with competing time for a legislator to meet for coffee, meet at, and we do that. And some people have reasons why maybe from a health standpoint still in COVID would not want to do that. Virtual, and you can bring people from all over the state now too, and groups of folks. So it really has changed how we do meetings as well. And I'm really excited about that. I personally would always choose to meet with folks in person if I can, but I realize that like this is an amazing opportunity, also reduces barriers significantly. And so I drank coffee today. I'm hyper by nature, and I'm super big fan of virtual engagement, and I don't see that going away in Washington State, and it'll be interesting to see what other states do to continue to incorporate that.
Yeah, I love that. And Julia, I'm curious because you work in multiple states, sort of what your perspective on this is and how it's been going.
Yeah, no, I would definitely agree with everything that was just said. I'm based in the DC area. We work on states across the country. I work with advocates that live in different parts of their states, and just like Washington State, other states are big and long drives to get to the capitals, and it's really opened up being able to have advocates be in the room for important moments. I mean, a challenge that we used to have and still do, but maybe that's lightened by the ability to do virtual testimony, is when a committee on a Thursday or Friday afternoon schedules a hearing for the following Monday or Tuesday, and then we're normally having to prep our advocates, who hopefully we already have a little bit geared up, but sometimes it's a matter of getting on a plane or asking, like, can you take off work on Tuesday and possibly drive down on Monday night and stay in a hotel and do all of these things that for anyone who's working or anyone who has a chronic condition where, fatigue might be an element of that is a lot to ask on such short notice and in such a tight timeline, especially if you're just making that trip to talk, for 5 minutes. And obviously we normally try to lump it in with other meetings, but that has definitely opened up possibilities in a huge way. We just had an advocate from NPF in California. She lives in Southern California, has a really impactful step therapy story. And with not tons of notice, we found out that there was a hearing coming up that the coalition wanted her to testify at. And instead of getting on an airplane and, like I said, spending a night somewhere, et cetera, she hopped on a phone call. It wasn't even a video. It was literally just a phone call. She waited on hold for like half an hour, which, like, all things considered, is no big deal, and was able to give her testimony. So I definitely think in that sense, it's opened up a lot of possibilities. We also did our Capitol Hill Day virtually, like I think a lot of groups did. And I think it's now starting a discussion of do we continue some type of hybrid option or something, taking into account that travel, again, is hard on folks and time consuming, and hoping that offices continue to be open to doing a mix of in-person and virtual meetings. Obviously the downsides are you don't bump into people in the hallways. You don't get to just pop your head into an office. It requires a two-way communication to get in front of someone. But I think all things considered, the staffers and representatives have been really responsive when I know they're flooded with emails. So I think in that sense, it's been really positive.
Yeah, that's awesome. Yeah, I just feel like the accessibility is so great, for people, like you both mentioned, to be able to just be so much more flexible with being able to hop on a call and still have such great impact. I think that, hoping that we can see that continue and see the benefit that really came from during COVID, like Representative Riccelli mentioned, a silver lining. Curtis, do you have anything that you want to add, any experiences that you've had over the last year and a half around virtual testimony or engaging with legislators online?
Just piggybacking off of what everyone has said so far, it allows for a lot more participation, and a lot more people are excited because they are and have that ability to participate at home and don't have to worry about travel and don't have to worry about bringing supplies or setting up an appointment for kidney patients at a dialysis clinic that they're not familiar with. So I know with one of our Capitol Hill summits last year, we were able to add an additional 200 plus delegates to come in and help speak on certain causes and stuff. So agreed, it's a big plus. And yeah, you do miss kind of the in-person touch, but the important part is getting your point across and getting your message out.
I would just add to one of the functions that we have in our legislature is the ability for people who don't testify, but through that process, they really became more aware of being able to sign in, support, or opposed, or other. And we saw those numbers increase. And legislators really looked at that, how many people were signing in, even not speaking, et cetera. And then I put in the chat box, but I just want to reiterate, we saw over 7,000 Washington residents sign into remote committee hearings. And that is, I mean, we were in the under 10,000 in previous sessions. So that I think is good. But I would also say, I'd ask you to join a lot of folks in the next big national initiative and state initiative to make sure that broadband is accessible to all people in an affordable manner. This is a win issue from telehealth to remote participation in our democracy. We've seen the gaps in COVID. I hope we can all really get behind that benefit.
Yeah, absolutely. That's so important. Thank you for that addition. And that's so exciting. I mean, that's a huge step. That's so exciting. So that's really great to see. Okay, great. I want to just mention if there's any other questions, we have a little bit of time for Q&A. So if anyone else has any other questions, Mary Kay, if you have something to add.
I'm going to open it up a little bit, but it was a question about sort of patient groups that, might be funded by pharma or device manufacturers or whatever. Also, Julie is a professional lobbyist, so I'll pop this to the representative first. How do you weight and balance the different voices when you might, especially in something like healthcare, where you might be hearing from industry, you might be hearing from patients, patient advocates, people on different sides of the same issue. How do you balance that out, and how do you sort of check for biases, but still be open to hearing what might be a completely legitimate policy issue?
Yeah, I mean, look, people might be offended if I say, but lobbyists do serve a purpose in this process. A lot of times they have information, they help work on policy matters. Representatives kind of understand. Some of us put people in kind of what we call white hat and black hat lobbyists, because of what they represent, and that's all personal kind of thoughts. But I think, there is a big difference between when we find out grassroots organizing and AstroTurf, as we call it, where there are fronts for organizing and efforts and people, and you can follow the money back to certain entities. I think that's deceptive. So there's a big difference between that and then just having open conversations when somebody's coming in advocating for a position. And so I do think it really, when an organization is discredited because they were putting themselves out there as one thing, and then that they're not actually, that has huge ramifications. And when we're working with all lobbyists and organizations, it goes back to the same way we work with people. It's trust. And when people break that trust, that has huge impacts on their ability to communicate their message going forward. So we like to hear when somebody's trying to rig the system and is maybe trying to put forward a public face that doesn't match it. And so I think that's an important message. It's kind of a blunt and harsh message, but we do see that. We see the influence of money in politics. And I think it's, the job of the people and ourselves to step back and try and, follow that money. The problem is it's very difficult. I'm a huge fan of overturning Citizens United so that we can try and take money out of politics. We have what we call dark money that's in politics. It's very hard to follow. and track, and it has huge influences. We've had major health policy alone. We've had major entities come in because they're just so influential and have so much money in our electoral politics. We're not able to move good health policy forward, for instance, an example, because we just can't get the votes because they have that much influence. So kind of a not super happy message, and just the reason why more people need to get engaged on individual level, because our collective voices should overrun that kind of manipulation.
Yeah, and I think Rose from, who I believe is from Washington State, as a really good, I think, relevant follow-up, as self-funded disabled advocates were accused of being funded by pharma. Even if they were funded by pharma, if they're still disabled and advocating for a position that is important to them, how do you throw out their opinion because they got some funding from somebody?
No, but I think it's always important for someone to start with, first and foremost, I'm a person, I'm a constituent potentially, I'm in your district. Your job, our job is to represent them and start from that standpoint and build that relationship. When people bring opinions and messages, it's okay to be informed. We're looking at research, we're looking at fact-based stuff. We have nonpartisan staff that we can work with to help run it. So I don't think it's a huge barrier if people are upfront. But I think just starting from that first place of like, I'm in your district and I have this lived experience and this is a public policy intervention I'm supporting is the best place to start. But I don't think there's anything wrong using access to lobby to create it. Believe in what you're doing, policy intervention, and you have that access. And there's a big difference too, I think, between, organizational lobbyists, what we have called contract lobbyists, and people who are, more like government affairs, working with an organization. Yeah. So,
Julia, you probably navigate this sometimes, or certainly see it in other organizations in the insights. And I know there's actually regional differences too in comfort with some of this stuff.
Yeah, definitely. It's definitely something that we encounter as everyone does, but then also that we try to help train advocates to directly address the question, which is like, what do you do when you're in that situation? I think a couple things from an organizational level, that I can only obviously speak for the National Psoriasis Foundation, but we try to be really transparent about where we get our funding. And so one of, my responses to that is just that you can go check out our annual report and see details about both our funding and how our priorities are set. And I'm kind of flowing into my second point, which is being clear about why you're here, whether it is a constituent or, for myself, that I'm representing people with psoriatic disease, and how we got to how our goals and the experiences of our constituents, again, in my case, folks with psoriatic disease, led us to supporting this policy issue. And so I think on the human level, level setting about why we're all here. We're trying to improve healthcare. We're trying to improve access to healthcare. We can talk through the funding details, but like, these are the reasons for our position on this. Shifting more to the individual advocate perspective, if you are there, as part of an organization, that's one thing. And it goes back to making the points that I was just making, but again, just focusing on your lived experience, focusing on why, you believe this is a good public policy priority. And sometimes too, just like acknowledging the players in the system, like when we're talking about certain policy issues that have to do with insurance reform or drug pricing or whatever it might be, there are much bigger, players in this game, or however you want to phrase it. Like, the patients are kind of the people who don't get to be in the room when contracts are being made between companies. And so that's why we have to go to lawmakers to try to pass policies that get patient protections, kind of in that room. And so just, I think having a clear discussion about your understanding of sort of the players overall, helps kind of recontextualize why you chose to come to that meeting and sit down with that representative. So I think a combo of things, but always going back to the lived experience and the personal impact of these policies.
Yeah, I think here's another interesting question, sort of an industry healthcare policy question, is about patients with intractable chronic pain. I think that this sort of ties into the opioid question, and I know there isn't a state in this country who is not dealing with this and struggling with controlling the opioids versus people who are managing chronic pain. Certainly a lot of cancer patients can't be taken off opioids. Others who've been on for years and years and years. What do we see happening out there in terms of access to chronic pain management in a sort of post-opioid world? That's kind of a light topic. Let's just take that up.
I mean, I'm in Washington State. We've legalized marijuana, and that's opening up some doors. Obviously, there's barriers at the federal level for research still, and I see that Senator Booker, Senator Schumer, and some others have introduced legislation on how it's scheduled, and we definitely need more research. There's some exciting research going on with our veteran, our VA, et cetera. But that's, I'm throwing out there, that's one thing that I think is being used. And we certainly see, we've done a lot, everybody across the country seeing the issues with prescription, with opioid addiction, et cetera. And it's devastating. It's ravaging our communities. It's causing so many problems. So I'm not sure that's a great answer, but that's one thing obviously we're looking into here in Washington State.
Yeah, Julie, are you seeing anything? You're a watcher in this area.
Yeah, I think this specific area is a tad outside of my direct policy wheelhouse. So I might just make a broader comment. If you are thinking about how to be part of these issues and move forward, access to treatment for chronic pain, I think just making sure you're well connected with whoever is sort of making that their top priority, and whether that's state or federal or representatives who are speaking out on it. I'd seen some comments in the chat earlier about kind of doing your homework before you go into legislative meetings, about knowing the positions of whoever you're talking to. And I think the flip side of that is if you have an issue you're interested in and you're not getting traction with your specific lawmaker, figuring out who is working on it, and just sort of going from there. But I think that's what I'll be able to contribute to this question.
I was just going to add, I think that's a great question and information. I want to thank Rose. I would say that, I think that's why unlocking ability for more research at the federal level for cannabis, et cetera. I will say there's other things through scope of practice that have been brought up. Acupuncture and other kinds of things that people are using that would be, I guess, considered more non-traditional have been coming through the legislature under scope of practice laws, allowing for different kinds of treatments from that way. And then what is actually being reimbursed for, that's another big piece, right? Like allowing providers that have these alternative methods of treating patients for chronic pain to be reimbursed and paid fairly for their services.
Yeah, I think one thing that having worked in healthcare policy before that people get very nervous about is they know things are complex, right? That there's all these rules that govern everybody's everything. And so sometimes patients don't want to speak up because they know they're not experts. So, and I know Curtis has waded into this, fairly recently, but so I'd love to hear from him. But also the others, like how do you talk about policy when you don't know about policy? And does that mean you have to be sidelined?
For me, no, you don't have to be silent. There are two ways to go about it. One is to do research and find out more about what's going on and become your own expert in what the cause that you're looking into. Second, see who else is out there. If you're not comfortable being the voice, there are other people that are out there who want to be the voice and are ready to be that voice for you. So get in touch with those people or that group, just like CDC. They are very much ready to be that voice for you. So you don't always have to be upfront. And I have a lot of friends who are that way. They're good at suggesting, they're good at looking at things and giving ideas and doing the research and stuff, but they may not be that voice. So they will give it to someone else who can be that voice.
Julia?
Yeah, and I can just add, I think definitely 100% to what Curtis just said. And then also, if you're in a meeting and it's starting to like wade into a policy issue that you're not an expert on because, it's tangentially related to why you're there, you can just say, I don't know, or like, it's fine to admit that you don't know. It's better than making something up or, agreeing to something that you're not sure about because it's not an area you're an expert on. So I think, especially if you're there to talk about your own personal experience and talk about relating it to a specific piece of legislation, you can just sort of be honest about that and say, I'm not actually sure about that policy. That's something I would have to look into, but I'm really here today to talk about this specific issue because it's what I know from my lived experience. And if you are having that meeting in conjunction with a patient advocacy organization, take a note on that, take it back to the staff at that organization and say, hey, I had a great meeting with this person, but they did ask me about this topic and I had no idea what it was. Like, can you either tell me about it so I can follow up or, basically just kind of give me a sense of why they were bringing that up so that you can figure out what to do with it next. But all to say that gives you a great excuse to follow up with the office. And so saying, I don't know is perfectly fine.
Following up is really important. And here's the not so secret. Most meetings that elected officials take, the people they're meeting with know more about the issue than they do. I mean, a lot of times we dig in on things, but we're largely, generalists working on different areas. We have different areas of expertise. So it is important to follow up with those questions. But this just gets back to my, please do not go in there with any sense of kind of intimidation or, really concerned about the power dynamics. If an elected official is there to learn, a lot of times they are asking questions not to poke holes in what you're bringing to them because they really you probably either know the information or have access better to the information that they need and that they want to make educated decisions.
Cool. Well, I didn't see any more questions in the chat. Tana, did any come directly to you? Okay, good. So we've just got a couple of minutes and we just want to close on talking a little bit about how the Coalition for Chronic Disease creates some of these pathways just to amplify patient voices. This is a combination of learning and talking, right? So for learning, we encourage you to sign up for our newsletters. We advocate on a couple of very specific policy issues. We're a fairly young organization, and we're excited to continue to grow. But so we've got some areas of knowledge and work, and Julie's talked about step therapy is definitely one of the issues that we advocate on. But you can sign up for email updates. We won't abuse you. It's about once a month, more if there's something super urgent that's national, but mostly we try to not kill your inbox. Also, just to remind folks that the congressional recess starts August 9th. And as the representative mentioned, when folks are home in district is a great time for them to connect with constituents. So, they'll do town halls, virtual or in person even. They'll attend, League of Women Voter type events, Civic Club type events, Rotaries. They'll be out there. So you can just go and see them in their environment. You don't even have to set up something separate if you don't want to, but use the fact that they'll be home in district for the next about 4 weeks to connect with your federal delegation. They are as much into meeting constituents as anybody else is, and often do have more staff. And as you heard in Representative Riccelli's bio, staff is usually away to other things. So if anything, always be polite to staff. They're often the policy experts. They are certainly the gatekeepers, and they almost always have bright futures of public engagement and service ahead of them. So think of these as also long-term relationships that you're going to build, but you can definitely start in your interim and to know the cycle that your elected houses operate in. It will be very helpful so that you can have longer conversations during downtimes. We also published today what we're calling our roll call of champions, the legislators who across the state or across the nation and all the states sponsored legislation that we were particularly interested in this year. So take a look and see if your elected representative sponsored legislation. Again, step therapy was one, copay accumulator type bills, rare disease councils. It's sort of, was kind of all over. So check out, and if you are represented by somebody who sponsored one of those bills, give them a shout out. And we know that a lot of folks who participate with us watch a lot of bills outside of what our interest is. So it's always worth it to know what your local legislator sponsored, because it's a lot of work to sponsor a bill. You really have to own it. You work for it. You want to see it successful. And so for folks who take the time and energy to do that, they deserve at the very least your thanks and your gratitude, and certainly your support and continued engagement. And they really want to hear from folks. And hopefully that is the big takeaway, is that they want to hear from you. And then Brian's going to show us how to do this, but July is Chronic Disease Month. And so we're trying to shine a light on some of these issues. And sadly, I think we're going to have a lot more people join the number of people who have chronic diseases. COVID is definitely going to leave some of us with long-standing conditions that are going to change the way that we access healthcare, that pay for healthcare, and live our lives. So as we sadly welcome those folks into it, we want people to understand what the life of somebody with chronic disease is. And so making those connections is going to be huge. I think it might be as many as 1 in 2 of us have chronic disease of varying severity, but it's definitely worth talking about how that cumulatively affects the health of our country. So I will get off of my little soapbox and let Brian show you how some of these things work in practice.
Yeah, thanks so much, Mary Kay. And that was a great discussion. I was watching from the behind the scenes here, and it was so hard to not jump in with my questions and additives, but you guys did a great job, and really appreciate the panelists taking the time today. So thanks so much for joining us. I'm clicking the link in the chat here to send our Chronic Disease Month letter in case anyone wants to follow along here. But really, I'm just going to show really quick how this sending a letter to your legislator can work on the Chronic Disease Coalition website, and share a little bit more about it. So should be looking at my screen here if you guys can all see that. Can I get thumbs up from panelists? Yep, looks like head shaking. So really just start by coming here to the chronicdiseasecoalition.org, and that brings you right up to our website here. You've got all sorts of tabs here to look at: take action, get educated, get involved. I would recommend taking a look at our policy issues tabs. You can take a real good look at everything that we're involved in at the legislature, and learn a little bit more about the policy issues that we're advocating for and that so many chronic disease patients are facing on a regular basis. I'm not going to dig into that right now because I think we all just had a nice full helping of policy discussion, but give it a read. There's a lot of great stuff to check out there. So I'm going to take us to our Take Action page, and this is really where you would come to take action, right, and get some quick, immediate turnaround here. So there's all sorts of different areas that you can do. You can join the fight, you can share your story, and I'm going to be looking particularly at contacting our leaders here. So if you come to that page, this is going to bring us to our Action Center, and you'll be able to see the various letters that you can send here. A really important thing to know about sending these letters on our platform is that they are state and issue specific. So if you're sending a letter in your specific state, and say you're trying to send one in Florida and you're in Pennsylvania, you'll run into some issues. So make sure that it's in your state, because you're going to be putting in some information, and it'll send directly to your legislators, directly to your state representatives and state senators. So this one, though, our Chronic Disease Month letter, is a great one to get engaged in because it's national. So anyone can send a letter, no matter the state. And we've got various targets here, including these are my targets here because I've put in my information in Oregon, Portland, but it's going to go president, vice president, state senator, state representative, governor, secretary of state, and then your other representatives as well. So it's a great letter to send out. It hits a bunch of targets and really just lets them know that July is Chronic Disease Month here. And it's July 29th, so time to really jump in on these letters. You've got an additional 2 days here to send one. And I would really recommend everyone to give it a go, but it's quite simple. I'm actually going to come down here and delete this address. Quite simple. You just jump in here. You can read a little bit about the issue here. This is the short description. And then on the right-hand side, you've got your targets. This would say senators, representative, president until you put in your information, and then it'll tell you specifically who those senators are. You've got your subject line here, your message body, and then we've pre-drafted a message for all of our letters. We do that just so in case letters get submitted and nothing gets added, then we still get to contact legislators. But it's always encouraged to share your story right here in the message body. You can put really any sort of addition that you want related to the issue. As we've talked about today, those personal stories are really the colorful touch. And you can imagine a legislator, might get hundreds, if not thousands of letters like these. So making sure that you get your message in there is really a great thing to do. But other than that, you put in your information, you put in your email, you put in your street address, and then you click send message. And you can sign up for email alerts and also remember your information so that when you're going to other action items and other issue areas that you're interested in, you don't have to fill out the form. You can just put in your message and click send message. And then typically you'll get a confirmation email once your information has gone through and your message has been submitted. And just know that this is also a great way to get in touch with the CDC. We've got all sorts of various channels, join the fight, share your story. But these letters we do monitor, and those great stories that we see, we love to get in contact with patients and all that sort of thing. So really a great opportunity to take action today, to take action right now. And we encourage everybody to reach out to us if they have any troubles sending a message, and then also checking out some of our other issue areas and some of our other action items, because the patient voice in a specific state on a specific issue can be really powerful, and we're always looking for that voice. And I will close there. That's my little spiel. I'd love to keep digging into the website, but it's been a long afternoon here, and I recommend everybody to go check it out. I've plugged it in the chat, and please let us know if you have any troubles.
I wanted to say, awesome, and looking for coalition building. Like, I am planning, because of a constituent meeting I had, potentially doing legislation on copay accumulators in Washington State. It's an issue I just heard of. So to me, I'm just like, this is awesome. What a great tool.
It is. I totally agree, Representative Riccelli, and it's a really quick, accessible first step, I would say. As we talked about today, I mean, there's testimony opportunities, there's physical conversations with legislators, coffee chats, so much more to be had in addition to these letters. So it's just a great, first way to get engaged. And we'd love to take your email and sign up for your newsletter, but no newsletter required. Really, truly, just send your letter and take action. So.
Yeah. No, it's the patient voice on complex things like copay accumulators. I think is really important, because it's really easy to get lost in the policy weeds. And so I think it helps when you can show how it affects families. So we really appreciate everybody being active on that one in particular. I certainly don't have anything else, and I'm about out of voice. So for the good of the order, Tati, do you have anything, or does anybody want to make any other closing remarks?
Yeah, I was just going to say thank you so much to our panelists for being here, spending so much of your busy schedule with us. We really appreciate it. And thank you to everyone for tuning in. There's lots of great resources that Brian just shared for you to get involved. And if you do have specific questions, follow up, want to connect with our panelists, please reach out. And Mary Kay did drop a chat. We would love to hear your feedback on Chronic University as a whole. So if you have ideas for different topics you would like to hear about, feedback on format, all of that kind of stuff, please feel free and reach out to us. But thank you guys. Panelists, do you have any closing remarks you would like to share? No?
We tapped you out, huh?
Yeah.
Okay. Amazing. Well, thank you all for being here. We will see you at the next Chronic University.
Thank you.
Goodbye.
Much.
Thank you, guys. Bye, everyone.
Thanks, everybody. We need your voices. Bye.